Hi sir, good morning or good evening. This topic is all about immunodeficiency. Immunodeficiency is a failure of immune system to protect the body from infections. It's because of the absence or insufficiency of some component process. Means ito yung immune system or nalalak siya is because of kulang or shortage doon sa ating immune system. That's why nagkakaroon ng failure sa ating katawan. It's because of shortage or lack of immune. It can be lose the ability to fight the infectious disease. That's why we call immunodeficiency. So, immunodeficiency is a state in which the ability of the immune system is compromised or entirely absent to fight against infectious disease and cancers. Kaya nga, yung sinabi ko ay pag immunodeficiency ka, it's because of shortage and lack of immune sa ating katawan. So that's why we are able to lose the ability to fight the disease or infection disease. As we can see, these are immunodeficiency causes. A weaker immune system is typically caused by certain disease, malnutrition, and certain genetic disorders. Syempre, ang causes niyan is because of the certain disease and malnutrition. At saka pagkakaroon ng genetic disorders. And syempre, I show here pictures, and as we can see in this picture, it shows frequent symptoms that are common for immunodeficiency, such as chronic cough, breathing troubles, pain in the ear, and nausea, vomiting, and diarrhea. And also, weight loss. Siyempre, pag weight loss ka, siyempre, very common naman yun na immunodeficiency ka. It's because of a shortage of lack of immune system. Kagaya ng sinabi ko kanina, it able to lose the ability to fight the infectious disease. That's why we are able to call immunodeficiency. Okay, let's proceed to the classification of immunodeficiency. Primary immunodeficiency and secondary immunodeficiency. Okay, let's talk about the primary or congenital or inherited, or which means a primary immunodeficiency. Primary means the disease does not result from another illness or conditions like a tumor, kasi congenital siya means it present at birth. Congenital is a disease or a physical abnormality present from birth. Syempre, there's factors na nagkakaroon ng kagaya ng sinabi ko kanina, lack of immune system, or there's walang ability to fight the disease during in the development. Cause of mutations genes involved in the development and functions of immune organ cells and molecules. During the development, there is a failure that the immune systems are not able to fight the disease. As we can see in the pictures, this is the physical abnormalities na nagaganap. It's because of losing the ability to fight the disease during the development. Kaya as we can see, there's in the pictures ay mga bata ay nagkakaroon sila ng physical abnormalities during the development of their parents na some for reason na there's a failure na nagaganap doon during the development. Uulitin ko po, kaya siya tinawag na primary immunodeficiency dahil po ay it present at birth or inborn. Okay, dadako tayo dito sa primary immunodeficiency. Is subdivided into types that cause the T cells deficiency, B cells deficiency, both T cells and B cells deficiency, complement deficiency, phagocyte deficiency, and immunoglobulin deficiency. T cells fight intracellular microorganisms including fungi, viruses, and also tumors. B cells defect include recurrent infections that are typically encapsulated bacteria. Ganun pa man, dahil deficiency means loss of ability to fight the disease and lack of ability na nagkakaroon ng shortage dito sa T-cells. Dahil po ang T-cells ay sobrang halaga po nito sa ating katawan. Lalo na po, ang T-cells ay para ipaglaban ang ating katawan, protektahan sa mga infectious and also to fight those disease. Kaya rin po tinatawag nating immunodeficiency kasi po kulang sa T-cells. Kasi ang T-cells, uulitin ko po, ay importante po sa ating katawan para ipaglaban ang ating katawan sa mga infections and also sa mga disease. Hindi lang po sa mga tao ang nagkakaroon ng immunodeficiency. Siyempre din po sa mga lahat ng organismo na nabubuhay dito sa ating mundo is meron po tayong T-cells, and pagkakaroon ng shortage dito sa T-cells ay hindi lang po tao ang makakaranas dito, syempre din ang mga hayop at anumang may buhay. B-cells deficiency are primarily antibody deficiency leading to recurrent cyanoinflammatory infections producing antibodies. Dahil ang B-cells, ang role niya po is to regulate the immune system by producing antibodies. Antibodies are protein that protect us when our unwanted substances enter our body. Siyempre naman po, kung wala ang B-cells ay nagkakaroon po tayo ng deficiency o shortage, lack of deficiency. Ganun din po sa T-cells ay nagkakaroon ng shortage na labanan ang disease sa ating katawan. Pag kinulang po tayo ng B-cells ay matatawag po nating na B-cells deficiency. This is the advantage of B-cells and T-cells. T-cells can wipe out infected or cancerous cells. They also direct the immune response by helping B lymphocytes to eliminate invading pathogens. B-cells create antibodies. Like what I say kanina, yun na yung kahalagahan ng dalawang cells, B-cells and T-cells. Non-infectious immunodeficiency. Not only infectious conditions should raise the suspicions of immunodeficiency, but also manifestations of allergy, inflammation, autoimmunity, lymph proliferations, or cancer, especially if they are recurrence associated to each other, affecting your young patients on a severe or difficult to treat conditions. Non-infectious immunodeficiency, this is hindi siya nakaka-infect or hindi siya nakakahawa sa ibang organismo o sa tao. Okay, let's proceed to the secondary acquired or secondary immunodeficiency. Secondary immunodeficiency or SIDS are acquired declines of immune cells counts and or functions, loss of immune functions that result from exposure to various agents. Immune system compromised by factors outside the immune system such as virus, aging, radiation, malnutrition, severe stress, splenectomy, thymectomy, or chemotherapy. This secondary immunodeficiency is ito po yung nakakawa or nakukuha natin sa kapaligiran unless doon sa primary immunodeficiency. Ang primary immunodeficiency ay inborn siya. Ito naman ay nakukuha natin sa ating kapaligiran such as mga virus, aging, and etc. or others disease na nakukuha natin sa ating kapaligiran. That is the secondary immunodeficiency. Infectious secondary immunodeficiency. Secondary immunodeficiency (SID) occurs when the immune system is weakened by another treatment or illness. The signs and symptoms of SID are the same as for primary immunodeficiency, that is, frequent, prolonged, or unusual infection such as AIDS and HIV. Ito po yung deficiency na natitreat natin but prolonged or matagal. It's very hard to treat. Immunodeficiency can be specific and non-specific. Specific abnormality of B cells and T cells. Specific means ito yung na-clarify or na-identify. Yung non-specific abnormalities of non-specific component is ito yung unidentified or hindi pa na-clarified.